Not all hip pain is due to arthritis. Sometimes subtle causes of hip pain can be an imperfect shape of the ball or the socket. What happens as you try to go through a natural, normal range of motion in the hip, that the ball and socket pinch together and oftentimes catches the labral tissue in between. Labral tissue is intimately meshed to the cartilage, so you get damage to the labrum, but also damage to the cartilage. And that's what we would call femoroacetabular impingement, or more commonly known as hip impingement. The symptoms we normally see in patients who have subtle causes of hip pain are generally groin pain. Pain is usually in the front of the hip, and this generally comes with more activity. The more active you are, the more the pain seems to flare. As you bring your activity down, it does get better. What we'll oftentimes see is pain with pivoting. So if a patient's running and pivot, they can get sharp pains within the hip. We'll oftentimes see catching, clicking, or popping sensations in the hip. They bend deeply or bring the hip up or in, they will oftentimes get sharp pain. So we definitely see this with more athletic, active lifestyles. X-ray is a good diagnostic tool. We are able to really visualize the subtle differences or subtle imperfections of the shape of the ball and socket. The X-rays are generally normal from the spacing in the socket that is normal cartilage and really without evidence of arthritis. An MRI with contrast is our best tool at this point to diagnose injuries of the labrum and the cartilage. And even though it's good, it's not perfect. It can miss subtle tears in the labrum or early cartilage damage. Thus, the gold standard of diagnosing and treating any tear in the labrum or the cartilage is hip arthroscopy. In the last 5 to 10 years, we've seen a significant evolution in the field of hip arthroscopy. We've developed tools that we can use to work inside the hip in a minimally invasive fashion. We can reshape that oval ball to a more round ball that has a more light bulb shape. Secondly, we're able to remove small portions of the socket that may overcover the ball. We're able to treat labral tears easily with reattaching it to the bone through sutures that are attached to bone anchors. And lastly, we're able to address the cartilage, whether that be repair or regenerated if needed. Generally with surgery, you can expect an overnight stay. We give you a block which numbs the nerves in the front of the hip, and it helps you be more comfortable for the first 12 to 24 hours. Immediately after surgery, we'll put you on a motion machine, which helps get the mobility back in the hip early on. The morning after surgery, you do a therapy session with a therapist. You're typically on crutches for 2 to 3 weeks, but progressing slowly from there. Generally, in the first week, you can expect to gain more independence. You become more comfortable. You're generally off pain medicine at that point. In the first 2 to 3 weeks, you're weaning your crutches and starting to really get back into your normal daily activities. You can expect to be sore at the end of those days of getting back into your normal activity. Over 6 to 8 weeks after surgery, you're going to be back at full daily activity, and we're going to be progressing your range of motion. By 3 to 4 months, we're back to full normal daily activity. We can start adding some jogging into the program and some more sports-specific activities. Generally, by 6 months, you're back to full unrestricted sports. From 6 to 12 months, the small areas of irritation in your hip slowly resolve over time. As the field of hip arthroscopy has progressed, we've got some collective results of the outcomes of hip arthroscopy, not only nationwide but worldwide. And what we know is that patients are significantly better after hip arthroscopy with regards to their pain and function. We know that repairing the labrum gives patients better outcomes than removing a small portion or just cleaning up the labrum. We know that patients that have open surgery take a significantly longer time to recover than what we're able to do arthroscopically. We know that you have to treat not only the symptoms, which is the labral tear, but you have to treat the cause as well, which is the shape of the ball and socket, to really get an excellent outcome.